we are discussing the metacarpal bone. So this is the metacarpal bone. It is formed, in the case of the ox, it is formed by two bones, that is one large metacarpal bone and one small metacarpal bone. The large metacarpal bone is formed by the fusion of third metacarpal and the fourth metacarpal, and these two metacarpals are fused here. And this is the small metacarpal which is present at the proximal end, and it is formed by the second metacarpal. In the case of ox, there are only these two metacarpals, that is large and small. And in the case of the horse also, we have three bones, that is one large metacarpal and two small metacarpals. And in the case of the dog, there are 5 different metacarpal bones. Now let's talk about the metacarpal of ox. The metacarpal of ox having two extremities, the proximal extremity and the distal extremity, and the two surfaces, the anterior surface and the posterior surface. Now let's talk about the surface. So this is the anterior surface, which you can see is the convex, and it is continuous with the lateral and the medial surface. Now the anterior surface possesses this groove. This is the anterior groove, and distally it contains this foramen, and this foramen continues till proximal. Okay? So now this anterior groove is formed because of the fusion of these two metacarpal bone, that is third metacarpal and the fourth metacarpal bone. And the fusion can be seen externally as well as the fusion can be seen internally. Externally we are seeing this groove at the anterior and the posterior surface, and if we look inside, if we look it through inside the bone, we can see the groove is internally present and forming two medullary cavity inside, as you can see here. There are two medullary cavities inside. So we broke this bone. Now let's talk about the proximal anterior surface we have done, and this also present one this metacarpal tuberosity here. It is rough for the attachment of some ligaments and tendons. We have done the foramens. There is one distal foramen, and there we also have the proximal foramen, which is seen here. Proximal foramen. This, it is also continuous. Now let's talk about the extremities. So this is the proximal extremity of metacarpal, and this is the distal extremity. The proximal extremity of the metacarpal contains two facets. The medial facet is large in comparison to the lateral facet. The medial facet is for the fusion of distal row of carpal bone, that is 3 plus 2 plus 3 fused. And this one is for the fourth carpal bone, which is of the distal carpal. And this proximal end forming the carpal joint, or we call it the knee joint. And now in the proximal end there is a small metacarpal, and this is the small elongated piece of bone which is situated posterior laterally. So with this you can identify the lateral and the medial surface. The lateral surface
have this bone
that is called small metacarpal, which is at the posterior lateral aspect of this proximal end of the large metacarpal. The proximal end of the small metacarpal bone is broad and it is narrow at the distal end. In most of the cases it fused with the metacarpal bone. Now let's move on to the distal end. The distal end is having two condyles, and these two condyles are divided. These two condyles are separated by this cleft. These condyles are separated by this cleft, right? Now ये condyles हैं itself. The condyles are again separated by this ridge, ठीक है? And these condyles are again divided by this ridge and having two articular surfaces. So in total we have 4 articular surfaces. Now we have done this. Now let's move to the posterior surface of the distal end. Posteriorly, these condyles are forming 4 depressions, and these 4 depressions for the sesamoid bone. These 4 depressions are for the accommodation of the sesamoid bone. And we have covered this distal foramen. Now what is left? And in the next video we will discuss the metacarpal of horse.